Fall prevention in long-term care, risk management, and resident assessment, presented by My ALF Training. Consequences of falls. Falls can cause people to restrict their activities, lead to depression, helplessness, social isolation, loss of confidence in independent mobility, injuries, and even death. Most falls occur as a result of multiple intrinsic and external factors. A successful fall risk management program requires organizational commitment and an interdisciplinary team approach to prevent and minimize falls. Key elements for fall risk assessment. Fall risk assessment should be completed prior to admission, with any changes in condition, and also quarterly. Risk assessment. Fall prevention begins with identifying those residents who are at risk for falls. A thorough assessment should take place prior to admission and whenever there is a change in the resident's condition. The following factors may predict an individual's likelihood of falling: diminished level of consciousness or impaired mental status, incontinence or need for toileting assistance, evaluation of lower extremity strength, impaired gait or balance, including the use of assistive devices, diminished vision, a history of falls within the past 3 months, blood pressure measurements documenting the actual values, medications including psychotropics, antihypertensives, diuretics, sedatives, narcotics, or hypoglycemic, other medical conditions including but not limited to low blood pressure, Parkinson's disease, arthritis, diabetes, vertigo, or stroke, and they can also include environmental issues. Interventions to prevent falls. Once risks are identified, the resident's healthcare plan should contain approaches to prevent falls from occurring. The following are some examples of interventions: occupational therapy, physical therapy recommendations, teaching correct use of assistive devices, environmental modifications such as lighting, location of furniture, clear pathways, low beds, daily schedule modifications, anticipation of needs including position changes and ambulation, toileting, food or fluids, physical assistance with daily activities, supervision, and pain management. Interventions to prevent falls continued. The following are more examples of interventions: padded clothing, such as hip protectors, proper footwear, podiatry consults, vision exams, exercise programs to improve balance and gait, walking, stretching, tai chi, or yoga are some examples. In addition, caregivers need to be trained to correctly transfer residents according to the identified needs in the resident's care plan. Staff communication. One of the most important aspects of fall prevention in long-term care communities is staff communication. Residents may have an initial low-risk assessment for falls. Over time, each resident's risk will change. Staff must be trained to immediately notify other caregivers as well as management of any conditional change that can lead to a fall. Any changing conditions should immediately trigger a new risk assessment. Staff follow-up. Staff should be trained to stay in the loop with potential fall risk. Follow up with management to be sure that steps are being taken to mitigate the risk and implement any new procedures necessary. Don't assume your coworkers know. This is a very important issue, and be sure to communicate with other staff about it. Responding to a fall. Facility procedures should provide clear direction to staff upon discovery of a fallen resident. In the absence of a nurse, direct care staff need to be able to recognize possible injury to an individual and respond accordingly. Procedures should direct staff in giving medical assistance to the individual, providing basic first aid, and notifying emergency medical professionals. Staff should also receive direction in monitoring for complications after a fall occurs. In addition, facilities should have written policies and procedures to address staff documentation and notification. Please ask your manager to review your facility's policies and procedures regarding falls and fall prevention. After a fall occurs, a post-fall investigation is initiated within 24 hours. Investigation of a fall. Every fall should result in a post-fall assessment to determine the cause of the fall and the need for additional or modified interventions. Comprehensive reporting information will identify the date, time, location, a description of what the individual was doing, assistive devices in use and their condition, environmental status, and physical or mental condition of the person prior to the fall. Review those assessments can also reveal a pattern associated with time, place, and staff present. Please ask your manager to review the appropriate documentation procedures. Post-fall assessment. The post-fall assessment may generate the following examples of information that could have contributed to the fall: lack of adequate supervision or staff assistance, change in the level of functioning, acute medical conditions including urinary tract infections, inadequate food or fluid intake, worn out, inappropriate, or ill-fitting footwear, sleep patterns, environmental factors such as lighting, obstacles, wet floors, anxiety or agitation, and side effects of medication. Post-fall documentation includes reevaluation of gait and balance, reevaluation of lower extremity weakness, medication regimen and changes review, orthostatic blood pressure measurements with documentation of actual values, intrinsic and extrinsic risk factors that may have contributed to the fall. Key elements for care plan include measurable goals for fall risk and injury prevention, planned interventions that address the individualized intrinsic and extrinsic fall risk factors identified during the fall risk assessment, interventions reviewed and updated based on the findings of the reassessments and/or the post-fall investigation, including individualized interventions which are reevaluated and updated to prevent or minimize the risk of falls, individualized interventions based on causal factors and/or identified risk factors, dates of falls and causal factors, if a fall occurred, interdisciplinary team involvement in identifying individualized interventions to prevent falls. Outcomes include individualized interventions identified in the care plan are implemented, and effectiveness of the individualized interventions is monitored and evaluated. Balancing maximum independence and safety. At times, a competent resident may disagree or decide not to follow the safety interventions identified on the care plan or the recommendations from a healthcare professional. Similarly, residents with impaired judgment or impaired cognition might not consistently follow or understand safety interventions. If a resident is not following a recommended safety plan, a reassessment may be needed to identify alternative, more effective approaches.